Now, Executive Suites with WPRI.com reporter Ted Nisi.
Seven years ago, two Brown University medical students had a big idea. People would find it easier to lose weight and get healthy if they tapped into the support of their friends, relatives, and colleagues. Their nonprofit, Shape Up Rhode Island, has grown into a for-profit wellness company, Shape Up Incorporated. Shape Up uses social networking, gaming, coaching, and rewards to promote healthy living through more than 200 employers and health plans that have signed up. They call it social wellness, and it's getting the attention of medical researchers. This week on Executive Suite, Shape Up co-founder and CEO, Rajiv Kumar. Welcome to Executive Suite. I'm Ted Nisi. Rajiv, thanks for being here.
Thanks for having me.
I remember Shape Up from my Providence Business News days, writing articles about you then, and it's just kept growing. I want to start with the basics, though, for people who aren't familiar with the company. We're going to talk about we're talking a little bit about the difference between Shape Up Incorporated and Shape Up Rhode Island. But let's just start with Shape Up Incorporated. You're the CEO. What do you do at Shape Up Inc?
So we power wellness programs for large corporations, mostly multinational global Fortune 500 companies. And they come to us when they're looking to find ways to engage their employees in health and wellness. So most large employers in the United States are self-insured, and they're seeing rising healthcare costs. And that's
self-insured meaning they pay their own insurance. They pay the hospital in the end, even though the insurance claims are done by someone else.
Not a lot of people understand that, because when you work at a large company, you get a card that says Blue Cross or United or Aetna, but actually your company is holding the risk for your health. And so every time you take a medication or have a doctor's appointment or have a procedure done, your company is actually paying the full cost of that.
And Blue Cross is just the office side of it.
It's just the administrator, right? It's called the claims administrator. So these companies are seeing a direct hit to their bottom line with rising healthcare costs in America. And there's a lot of reasons, and we can get into why healthcare costs are rising. But companies come to us and they say, we want to activate a large percentage of our population to increase physical activity, to lower obesity in our population, and to prevent long-term illness. And they come to us and we power a software platform that helps to do just that, to activate employees and get them moving in the right direction. And
it's described as team-based, it's employer-sponsored. It kind of sounds like Facebook for weight loss to me.
That's how we pitch it very often.
What? Give me a sense. Let's say Channel 12 wanted to sign us up, and for Shape Up Incorporated, what would happen first on the employer side? What's the ask? What does it cost them? And then what do the employees actually do day to day?
Sure. So when we contract with an employer, they're generally paying us on a per employee per month basis. And it depends on the size of the organization and the level of service that we end up providing. So the price will range pretty dramatically.
You don't charge CVS what you charge a little nonprofit.
Right. Very different pricing models. But essentially what the company will decide is how they want to implement this program. Is it just going to be the online component? Are they going to incorporate coaching on top of it? Are they going to offer financial incentives or other types of prizes? And we'll actually organize the whole annual curriculum for the program. We'll run multiple challenges a year. We'll have different topics: nutrition, physical activity, stress management. We'll manage the entire incentive program, and then we'll do all the back-end reporting to the employer on how their employees are engaging and improving their health. We'll work with the company and do a lot of marketing to get the employees engaged, so through posters and emails and different types of electronic communication. And then we'll work with that company month after month to watch the engagement and look for interesting and creative ways that we can continue to keep employees engaged over time.
So the Shape Up experience really varies for each company. You sort of design it custom made for whoever signs up?
Exactly. It's the same software platform, but we can configure it to match the look and feel of a particular company and to run according to that company's goals and metrics.
IBM's Center for Social Business called you literally a game changer on employee health, because games are a big part of this. And I know you've been pleased with the results, the individual stories of people who've succeeded in losing weight. I know as someone who's struggled with my own weight over my life, how tough that can be. Tell me about some of the people who've told you this program has helped them.
Well, we've been doing this program now for almost 8 years, and we've touched a lot of lives. In fact, we're coming up on 1 million registered participants in the program. We'll hit that target sometime in the next month or two. And so you can imagine we've gotten a lot of success stories over the years coming in. I think, my favorite ones are the ones that came in locally through the Shape Up Rhode Island program, because that's the chance I get to actually meet people in person. And they come up to us at events and they share their stories with us. And some of my favorite stories, one gentleman came up and said, I lost 10 pounds as a result of this program. And he said, the fascinating thing is I wasn't able to walk before, but 10 pounds of weight creates 40 pounds of pressure on my knees. And so I
Wow.
lost 10 pounds, and I'm actually able to get up out of my wheelchair, and I'm walking for the first time in 10 years. You know, that kind of struck me and kind of reminded me that sometimes it takes small changes to make a really big impact on a person's life. And when we think about the population in America, 2/3 of us overweight or obese, 90% of us not exercising on a regular basis. If we just start to get moving, even if we're losing a few pounds, we're moving in the right direction, we can have a dramatic impact on our health.
And I think Rhode Island, even though we are actually one of the less obese states, we still have more than 60% of the state, I believe, is either overweight or obese, one or the other, so it's still a signitent problem.
And we have a high burden of diabetes in Rhode Island too, so it's actually not commensurate with the amount of obesity we have. It's disproportionate, but diabetes is a major problem here too, and that's lifestyle related. 90% of diabetes is type 2 diabetes, and it's not only preventable, it's reversible. And so we're trying to get people to take action and to leverage their colleagues and their friends and their family for support, because it's impossible to do alone.
Now, many people watching this show here in Rhode Island might have heard about Shape Up Rhode Island as a nonprofit. I know I've had friends whose employers took part, and they were tracking their number of steps they had a day and logging with their team what they were doing.
Sure.
And now, as we've mentioned, Shape Up Incorporated is a for-profit company with much bigger global viewpoint and you're working with. Can you give me a sense of what's the difference between the two and sort of how Shape Up Rhode Island wound up creating Shape Up Incorporated?
So I first conceived of Shape Up Rhode Island as a community initiative. When I was a first-year medical student, I saw my patients struggling with how to lead a healthy lifestyle. And my goal was simply help them to lose weight. And so I started this originally as a nonprofit project, and it was just meant to help a couple hundred people a year achieve their health goals. And it turned out to just go viral. People loved the concept. People started telling their friends. And the first year we rolled it out, 2,000 people signed up. We had no marketing budget, it was all word of mouth. 2,000 people signed up, they formed teams, and they started to compete. And so what we did is turn it into an annual competition here in Rhode Island. So it's been going for 7 years strong. I think we're in our 8th year
And still
now.
going, right?
And still going. And we do this every year, and thousands of people from all 39 towns and cities in Rhode Island sign up every year. They form teams. They're working either through their workplace or alone with their family, friends, colleagues, neighbors, and they're competing to exercise, to lose weight, and to lead a healthy lifestyle. So that's the nonprofit organization, and we've continued to run that program for a long time. Separately from that, in the second year of the program, we saw an opportunity to create a larger organization to service the needs of larger corporations across the country. And really it was local companies that came to us and said, can you do this for our employees outside of Rhode Island? And this was great for our Rhode Island employees. They loved it, but we want to roll this out across the nation or even across the globe. And so companies like CVS Caremark and G-Tech and FM Global and a whole host of other companies came to us, and we started working with them. And that's really when we started Shape Up Inc. as a for-profit company to raise capital so that we could scale this initiative across a large population.
All right, we have to take a break. When we come back, we're going to talk about, as a medical student, how Rajiv first got the idea for Shape Up Rhode Island and leading into Shape Up Incorporated. And then we'll talk some more about why the company is here in Rhode Island. Stick with us. You're watching Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and my guest is Rajiv Kumar. He is a graduate of the Brown University Medical School, as well as Brown University, and he's the CEO of Shape Up Incorporated, as well as founder of the older nonprofit Shape Up Rhode Island, which a lot of you may be familiar about. I want to go back in time a bit here, Rajiv, and talk about what first got you thinking about these issues of chronic illnesses and obesity in particular. Rhode Island Monthly did a great profile on you, and you talked about a class with Dr. Rena Wing, who's a noted obesity researcher at Brown. What did she talk about in that class, and how did it get you start to think what led to all this?
Yeah, so Dr. Wing came and she talked to us about obesity and diabetes and the growing epidemic across the country. And one of the things that she did in that class was she showed us a series of slides, PowerPoint slides, from the Center for Disease Control and Prevention. And these famous CDC slides map and chart the growth of obesity state by state over the past 30 years. I'm a sucker for a good chart. Yeah, and so that data point, watching that, every year, year after year, the rate of obesity across the country went up in every single state for 30 years to the point where it doubled, was really a dramatic data point. And for me, that got me thinking a lot, and I started to do more research about this phenomenon. And it was interesting because the timing, timing is everything sometimes when it comes to having an epiphany on, a viewpoint or philosophy. But I started to think about, Governor Mike Huckabee, who was on the news almost every day, and President Bill Clinton talking about obesity and the epidemic. And then I started to connect the dots to the data that Dr. Wing showed. And then I started to look at my own patient encounters during medical school. And I saw a lot of patients who were struggling with their weight, who were struggling to stay physically active.
These are people right here in Rhode Island, right?
Right here in Rhode Island. And when I talked to those individuals, what I found was that while it was so difficult for them to change their lifestyle, the people who did, who actually succeeded at losing a few pounds and lowering their blood pressure, lowering their cholesterol, were those that had leveraged their friendships, their colleagues, their relationships. And the people who did it together with others were much more likely to succeed. So I started to think about maybe there was an opportunity to bring people together, because we often treat health as an individual or solo personal endeavor, but it's also a social endeavor. The people around us have a dramatic influence on our health. And if we come together, we can actually support each other, motivate each other, and hold each other accountable. And that accountability is a really key part too. So I started to think about how do we make this fun. Thought a lot about Weight Watchers and Alcoholics Anonymous, and while those are really effective group behavior change programs, they're not that much fun.
No,
right?
no,
So
no one's associates Alcoholics Anonymous
exactly.
with fun.
So we decided to turn it into a game, and let's create a competition where people can compete, like a Biggest Loser type of program. So the combination, Biggest Loser was blowing up around then too. So the combination of that data that we saw in class, my personal experience in working with my patients, and then seeing that opportunity to create something that locally that could excite people was really the catalyst for this program.
And Dr. Wing, the professor at Brown we're talking about here, you and Dr. Wing have done academic research on the impact of Shape Up. What did you see when you drilled down, you put on your academic hat along with her, and what did you see when you drilled down into it?
Yeah, so Dr. Wing came to us years ago and she said, this program sounds fascinating and I hear a lot of great things about it, but let's prove whether or not it's actually working. Let's see if there are real weight losses happening.
Tough
and
professor.
So, yeah, right? So she came in and we looked at data points on 6,000 people that were participating in the program. And she actually took a subset of the population and weighed them before and after. And what she found was that people were really losing weight, and clinically significant amounts of weight. Enough so that she took a really strong interest in continuing to research the program. What we've done together over the years is look at ways to enhance the weight loss outcomes. So using behavioral techniques, using coaching, using personalized messaging, finding ways to help people lose actually more weight than what might be considered modest weight loss in the program. What we've also started to do is experiment with different incentive philosophies. So what can actually help people?
What works?
Small dollar amounts work. Frequency, so giving people immediate gratification, don't make them wait for a long period of time to earn the incentive. And then that positive reinforcement seems to really work. So we're leveraging behavioral economics.
I was just going to say, and I know you were economics during your undergraduate years at
Correct.
Brown, right? As part of the program in medical education. So do you find, you're pulling together a lot of different strands of thinking and research here. You've got the tech, social networking side, you've got behavioral economics, you've got the basic medical questions on obesity, but are you surprised by how well it seems to have worked? Or it's been so many years now that you're a true believer, obviously.
No, we continue to be surprised. When we talk about using a game to activate people, we think of games as kind of fun and superfluous, but games can have a real social purpose. And in this case, we're helping people change their personal lives. We're helping to reduce healthcare costs for the global healthcare system. So we continue to be surprised by the impact, but the evidence is piling up. We've published studies with Dr. Wing showing that weight loss spreads from person to person. So there is a social dynamic to all of this, and we're capitalizing on what we've learned, and we're using that and leveraging it to help people.
Now, on the Shape Up Incorporated side, where you're the CEO, well, you've been the CEO since last year officially, obviously you've been involved the whole time. And I know you co-founded that with Brad Weinberg and a fellow doctor at Brown. From that picture, that epic picture, the two of you we saw at the top of the show here. What do you see as the business opportunity here? There's a lot of talk now about the opportunity for wellness in the years going forward. Larry Merlo, CEO of CVS, was just speaking to the Providence Chamber this week about how managing wellness and managing medical behavior is a huge business opportunity. What do you see there?
Well, I think it's going from being a nice-to-have, kind of touchy-feely, warm and fuzzy type of program that companies did because they thought it was a good thing to do and they wanted to look good in the eyes of their peers and the eyes of their employees, to really a business strategy, right? So we're seeing wellness as a true business strategy, and that it's critical for attracting talent to your company, it's critical for boosting productivity and morale and reducing absenteeism, and it's critical for controlling healthcare costs that hit your bottom line. So I think there's a tremendous opportunity. I mean, we see data that almost 90% of companies today have wellness programs in place, and they're continuing to increase their investment. So even though we're in kind of an unclear setting where some companies might be having their employees move to the exchanges, some companies are talking about getting out of the business of providing health insurance, even in that setting, companies are saying wellness will not go away. We will continue to invest in wellness because it's the right thing to do, and we see tremendous business value in doing so. So I think there's a really great opportunity. Healthcare reform is pushing it and propelling it forward. One of the interesting provisions that not a lot of people know about in the Affordable Care Act is that companies can now spend 30% of an employee's premium on incentives, and at the discretion of the Secretary of Health and Human Services, up to 50%. That's a lot of money that companies can now play with to provide economic reward for employees who get a health assessment, take their biometric screening, participate in a program like Shape Up, and really take control of their health.
And the hope, of course, being partly that if you do a program like this, you're not paying for, God forbid, an amputation down the line because of diabetes or some very costly medical intervention.
Absolutely.
All right, well, we're going to take another break. When we come back, we're going to talk about Rajiv's view on the ongoing economic development debate in Rhode Island as the head of a company there and someone who came here for school. Stick with us. You're watching Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi. My guest is Shape Up Incorporated founder and CEO Rajiv Kumar, a graduate of Brown University, which is what brought him here from Connecticut, I believe, right?
Correct.
So your parents immigrated to the United States from India, and you were born here. When did you decide to become a doctor? I think that might be something with a little bit of a background in your family.
Yeah, so I come from a family of doctors. My mother's a physician, my sister is, my aunts, uncles, grandparents for many generations. So you can say it runs in, it's in our blood, so to speak. So since I was 6 or 7, I was thinking about a career in medicine, and actually I always wanted to be a pediatrician. So I always loved working with kids, and I just found it to be very refreshing. And I thought, this is something I could wake up every day looking forward to doing. And so, that was my plan ever since I was a little kid, was go to medical school and become a pediatrician. And you stuck. A lot of people have plans when they're little kids, but they don't end up following through on them. But you stuck with it. You ended up choosing Brown University, and you were in. And I'm curious what you think of it. The program in liberal medical education at Brown. It's not really well known, but it's a really interesting model that Brown has for people like you who come in knowing they want to do medical training in the end, but want to look at other things first. What is that, and what did you think of that program? Yeah, well, so it's not a very well-known program, but it is for anybody who's interested in going into medicine. So among high school students who want to be pre-med, it's a very well-known program, and in fact, very hard to get into. So I never dreamed in a million years that I was going to get in. But the virtue of the program is it's designed to let you explore other interests that you have. So the idea is to not just have physicians who have spent all their time focusing just on hard sciences, but letting them kind of develop other areas of interest. And for me, that was business. When I was an undergrad, I was a business economics major, and I took entrepreneurship classes. I started a couple of ventures in my free time. I started a nonprofit organization. And so, that was really the beauty of the program, and it allowed me to explore other horizons and to kind of become a more well-rounded physician. And how important was that now to you that you have those two different sets of education, or that they're directly related, but that you did that at first? I think it's critical. I mean, I'm bringing both of those disciplines together in our business, right? We're a company, so we're running an operation. It's entrepreneurial, it's venture capital backed, and we're selling to other businesses. So there's the business background is incredibly helpful, but also a perspective on healthcare and understanding of the basic science behind what we're trying to do is critical too. So Shape Up, it's here in Rhode Island. You've got dozens of employees now, I think. We've got 70 employees. 70 employees here in Providence. Your revenue's grown, I think, more than 5-fold. And first of all, did you ever think about going either back to Connecticut or to New York or somewhere else? What made you decide, I'm going to build the company here in Rhode Island? Well, so the medical program at Brown is 8 years long. So you do 4 years of undergrad and 4 years of medical school. So in that time, I fell in love with Rhode Island. I put roots down here. I got to know the community through nonprofits I had created. And so it was just natural that when we started the company, which we did in the middle of our second year of medical school, that we would start the company here. And then when Brad and I actually left med school for 2.5 years, we stayed right here locally. And and now our employee base is here, and we still really love the opportunity to continue to run Shape Up Rhode Island. And so, the company's here, and we really like Rhode Island as a place to do business. As you know, there's a big discussion going on in Rhode Island right now about how to be a better place for companies like yours, entrepreneurs with an idea, growing fast, and a lot of different debates about how to spur economic development, what people need. When you look at Rhode Island, what is it that comes right to mind about what could make the state a better place for companies like yours? Is it taxes and regulations? Is it education and training? Is it something else? What do you look around and see? Yeah, the taxes and regulation have not really been a big issue for us. I don't see that as a major impediment to doing business in Rhode Island. I do think at the end of the day, it comes around talent. That's the biggest challenge, and especially technical talent. So for software companies like ours that are trying to truly scale and grow into very large companies, being able to source great local talent continues to be a challenge. And in fact, a lot of times we end up having to go to the greater Boston area and recruit talent that's commuting every day, up to an hour each way, because we can't find the talent that we need here. So we need to be investing more in the community and in training programmers and other types of technical workers to join the growing number of technical startups here. I mean, Beta Spring is doing a great job, but we can do a lot more in this technology realm. I think we could, exponentially increase the number of technology companies here in Rhode Island, but that talent pool has to be here.
I guess my next question would be, I mean, does that mean we try to lure MIT down here? How do we build that up? And it might be a number of different ways, but do you see any low-hanging fruit or anything that could really spur more of those people going down that track?
I think we need to train programmers. The programmers are in short supply and in high demand all across the country. And if we can find a way to create, it doesn't have to be a institution like an MIT. We can train people to program through online classes, right? There's Code Academy and all kinds of ways to learn how to code online. But if we actually had a focus and we were investing in that, we could create a whole generation of developers here, and that would draw companies, and it would spur new companies to get started.
Last year, Walker Williams, who founded Teespring, was on the show, and he talked about, when I asked why he was staying here after graduating from Brown to work on building it, he said a big part of it was the community, having mentors here, having people to help you build it up. He said that's crucial, especially when you're a younger company phase. Would you agree with that? What do you think of that?
The mentors locally have been essential for us. When we first started, one of the first milestones was we won the Rhode Island Business Plan competition. And a lot of the judges became our mentors. People like Garrett Hunter from the BDCRI and Larry Davidson at KLR. And we met a lot of local entrepreneurs and investors through that initiative. A lot of our early investors in ShapeUp were local entrepreneurs and angel investors. And then we've had always mentors in the space that have been a couple of years ahead of us in running their companies, and we've relied on them, people like Charlie Kroll at Endera. So I think the mentorship has been critical. Not just to keeping ShapeUp here, but in helping us to grow and thrive. So
looking back to ShapeUp, when you look forward this year into next year, what are you excited about? What's coming down the pike for your company?
I'm excited about technology. There is a whole consumerization of healthcare movement happening where individuals are starting to say, I can take control of my health. I don't have to wait for somebody else to help me. I'll do a show and tell here for a minute. This is a Fitbit Flex.
Okay.
Right? And so this is a wireless activity tracker that tracks all my physical activity, both in steps and minutes. It tracks how well I sleep and how many calories I burn, and it syncs wirelessly with the ShapeUp platform. And so every day I can log on and I can see how I'm doing compared to my goals. My friends can see my progress and cheer me on. I can earn rewards and prizes, and I can get positive feedback right from the platform. This has been out for 2 weeks, brand new device. But people are buying this, the Nike Fuel Band, the Jawbone Up. There's a lot of consumer technology, and we're able to tie that into what we're doing to activate people. Talk about mobile apps, right? People are tracking their calories, they're taking pictures of their food and getting insight on what they're eating. They're doing all kinds of really fascinating things, leveraging the accelerometer and the GPS inside their phone. And we're bringing all of that to bear in a very social setting, and it's powerful.
All right, that's all the time we have this week. I want to thank Rajiv Kumar for joining me on Executive Suite. If you missed any of the show or you want to learn more about ShapeUp, just go to WPRI.com. We'll see you next week on Executive Suite. Great.
Thanks.